welcome to today's episode of Man on the Street. Please state your name and your occupation.
My name is Josh. I'm a licensed vocational nurse, and I currently go to school for medical billing and coding.
Great. All right, let's get started. Okay. Question number 1. According to the CDC, how many minutes of moderate intensity aerobic activity do adults need weekly? A, 50 minutes, B, 250 minutes, C, 75 minutes, or D, 150 minutes?
Well, I think they said do 30 minutes a day, so 30 times 7 is 210, so maybe closer to 250 minutes.
That is incorrect. It's actually 150 minutes.
Oh, that's it?
2.5 hours of endurance activity to improve cardio fitness. Next question.
Yeah.
All right. Which term is utilized in eye and vision care? Is it A, orthopedics, B, ophthalmology, C, orthodontist, or D, podiatry?
B, ophthalmology.
Very good. Do you know what the other ones stand for? Or do you know what the other ones have to deal with?
I mean, orthodontist has to do with your teeth, like, well, I know they deal with braces. Right?
Mm-hmm.
Podiatry, like your feet.
Yeah.
Orthopedics. I should know this, but...
It's on the musculoskeletal
oh, okay,
system.
yeah. Because,
All right.
Question.
Next. Okay. What is normal blood pressure for adults 20 years or older? Is it...
oh, go ahead.
Oh, go ahead.
Oh, I was going to say B, 120 over 80.
Yes. You are correct.
Next question.
Do you know what these numbers stand for?
Your systolic and diastolic pressure.
Yeah. What does that mean?
I'm not sure. I forgot.
Systolic, it measures the pressure in the arteries when the heart contracts.
There you go.
And diastolic is the pressure in the arteries between heartbeats.
Oh, yeah, I was going to say that.
Next. Okay. Which type of disease is high blood pressure or hypertension a main risk factor for? Is it A, lung disease, B, infectious disease, C, heart disease, or D, autoimmune disease?
I would have to say heart disease.
That is correct. Also, hypertension is the single most important risk factor for a stroke. Next. What is the leading cause of preventable death in the United States? Is it A, motor vehicle collisions, B, tobacco use, C, heart disease, or D, obesity?
Ooh. I'm 50-50 on the tobacco use and obesity. But I think I would have to say tobacco use.
Yes. Ooh, you're on a roll. So, tobacco use is a major factor in 4 of the 5 leading causes of death in the United States. Number 1 being heart disease, which causes 1 of every 4 deaths, followed by cancer, lung disease, and then stroke. Next. Okay, what does HMO stand for?
Oh.
Is it A, Health Managed Organization, B, Hospital Maintenance Organization, C, Health Maintenance Organization, or D, Health Management Options?
Oh my god, dang. I should know this. But you made it like very tricky. I'm gonna have to go with C, Health Maintenance Organization.
Yes. You're either a really good guesser or you know your stuff. Okay, next question. This is a 2-parter. What does PPO stand for? Is it A, Provider Plan Organization, B, Planned Provider Organization, C, People Provider Organization, or D, Preferred Provider Organization?
I'm gonna have to go with D, Preferred Provider.
Correct. And do you know the difference between the two?
The main difference between HMO and PPO would be that PPO you can choose your provider, HMO not really, and usually with a preferred provider you pay a little bit more for that plan.
This is correct. That's true. Those are some differences. Also, HMO, you must designate a primary care physician. And then insurance will only cover care from a provider within your network.
Mm-hmm.
All right, next question. 2 more. Well, 3 more. What is the DRI for fiber for men and women through to the age of 50? Is it 38 grams and 25 grams, 28 grams and 18 grams, 30 grams and 21 grams, or 42 grams and 29 grams?
What's the M?
For men is the first one, and then
okay.
women.
Oh, wow. I would have to go with B, 28 grams and 18 grams.
That's incorrect.
Oh, no.
The answer is A. It's 38 and 25.
Oh, okay.
So the average person only gets about 15 grams per day. Diets rich in fiber can help reduce risk for heart disease and type 2 diabetes, improve cholesterol, and regulate digestion. And then 30 and 21 are for people over the age of 50.
Oh, okay.
All right. Second to last question. What does BSE stand for?
Breast self-examination.
Correct. So women can choose to conduct regular BSEs, but this should not replace regular screening, mammograms, or clinical breast exams. A little windy out here. Okay. And the final question, at what age should women get annual mammograms? Is it 30 to 39, 40 to 44, 45 to 54, or 55 and older?
You should start at the age of 30, so A.
That's incorrect. It's actually 45 to 54, so C.
Oh my
so
gosh.
Women ages 40 to 44 have the choice to start.
I know it. Okay, go ahead.
But it's recommended that women ages 45 to 54 should get mammograms every single year, and then 55 and older should switch to mammograms every 2 years.
I think where I got the 30 is if you have like a history of like breast cancer in your family, that you should start like at 30 or
Great. And you are all set. Thank you for participating. I hope you learned something for future reference.
I did.
Thank you. What is your name and your occupation?
My name is Mark Soliman. I'm a pharmaceutical sales representative.
Awesome. Okay, first question. According to the CDC, how many minutes of moderate intensity aerobic activity do adults need weekly?
Okay, so 30 minutes times. I'm going to say 250 minutes.
That is incorrect.
No.
That's also what Josh said, though. It's,
Oh no, it's 75.
No, it's actually 150. 150
Oh,
of endurance activity.
Alright, okay.
Next. All right. Which term is utilized in eye and vision care? Is it?
It's ophthalmology.
Yes,
Yes.
that is correct.
1 for 2.
Okay. What is normal blood pressure for adults 20 years or older?
120 over 80.
Yes. Do you know what these mean?
Yeah, systolic diastolic.
And what does that mean?
Systolic is the pressure that the heart pumps, and then diastolic is when it fills back up. Something like
Yeah.
that.
Actually, yeah, that's correct.
Yeah. I sold hypertension medication, so.
Then I would hope that you know this. Okay, which type of disease is high blood pressure or hypertension a main risk factor for?
Heart disease.
Yes.
I sold
Ooh.
hypertension.
On a roll. Okay, what is the leading cause of preventable death in the United States?
Heart disease.
It's actually
No?
tobacco use.
No.
Sneaky,
preventable.
sneaky. There you go.
Preventable.
Yep. That's
Heart
correct.
disease is number 2 then, probably. No, it's it's.
Heart disease
not.
is the leading cause of death.
Yeah, leading cause.
Yeah, that's probably what you're thinking.
Yeah.
I tried to trick you.
Okay.
Okay, what does HMO stand for?
Health Managed Organization.
It's actually C, Health Maintenance Organization.
Yeah, those are the answers are pretty tricky.
I know they're. same
No,
thing.
it's not the same. Are those? Okay. Close enough.
Okay. What does PPO stand for?
Crap.
It does not stand for that.
Well, organization definitely. People provider organization? No?
That's incorrect. It's preferred provider organization.
Okay.
Second part of the question.
Oh, okay. What's the difference between HMO, PPO? PPO is more expensive.
That's
No,
true.
HMO, I think they lock you into a primary provider, whereas PPO, you have more options to go anywhere you want.
Yes, correct.
Something like that.
You get half a point.
Oh, I have no idea what this is. What is the DRI?
What is the DRI for fiber for men and women through to the age of 50?
Oh man. 30 grams, 21? See?
No.
I don't
It's
even know what that
38
means.
grams and 25 grams.
Okay, that was my second.
30 grams and 21 grams is actually for people over the age of 50.
Over the age.
Yeah.
Okay.
And the average American usually only gets about 15 grams of fiber per day.
Okay. So DRI, daily recommended
Intake.
intake.
Yes. Okay, final two. What does BSE stand for?
No idea.
It's a breast self-examination,
Okay.
which leads into the next question.
At which age?
At which age should women get annual mammograms?
I'm gonna say 30 to 39.
That is
No,
incorrect.
40 to 44.
No.
45 to 44.
Yeah. Process of elimination, yeah.
All right.
And then over the age of 55, it should switch to mammogram every 2 years.
Every 2 years. Okay.
Yes. Thank you for participating, and I hope you learned something.
Yeah. I learned that I don't know anything.
Hi, my name is Aubrey. I'm a bar method fitness instructor.
Okay, so let's get started. Question number 1. According to the CDC, how many minutes of moderate intensity aerobic activity do adults need weekly? 50 minutes, 250 minutes, 75 minutes, or 150 minutes?
I'm gonna go with 150 minutes.
Woohoo! You got that correct.
Oh, nice.
So it's 2.5 hours or 150 minutes of endurance activity to improve cardio fitness. Next question. Which term is utilized in eye and vision care? Is it A, orthopedics, B, ophthalmology, C, orthodontist, or D, podiatry?
B.
You are correct. Do you know what the other ones are?
Yes. Orthodontist is for teeth. Podiatry is for feet.
Yes.
Orthopedics is for it's like back stuff.
Bones,
Bone stuff.
joints, ligaments. You are correct. Number 3. What is normal blood pressure for adults 20 years or older? Is it 120 over 90, 120 over 80, 140 over 95, or 160 over 100?
My random guess is gonna be B.
You are correct. Hooray. Do you know what either of those mean?
Nope.
Okay, so 120 is, it measures the pressure in the arteries when the heart contracts, and 80 is the pressure in the arteries between heartbeats.
All right.
All right, which type of disease is high blood pressure or hypertension a main risk factor for? Lung disease, infectious disease, heart disease, or autoimmune disease?
C.
Correct, which is also the leading cause of death in the United States. Thank you. All right. What is the leading cause of preventable death in the United States? Is it motor vehicle collisions, tobacco use, heart disease, or obesity?
Obesity.
That is incorrect. It's a good guess, though. It's tobacco use.
All right.
So, tobacco use is a major factor in 4 of the 5 leading causes of death in the United States. So that's heart disease, followed by cancer, lung disease, and stroke.
Good thing I don't smoke.
There you go. All right, what does HMO stand for? Is it Health Managed Organization, Hospital Maintenance Organization, Health Maintenance Organization, or Health Management Options?
Oh, let's go with D.
That is incorrect. It's Health Maintenance Organization.
Okay.
This is a two-parter.
Okay.
What does PPO stand for? Is it Provider Plan Organization, Planned Provider Organization, People Provider Organization, or Preferred Provider Organization?
D.
You are correct. What is the difference between an HMO and a PPO?
I don't know.
There you go. All right. HMOs must designate a primary care physician, and the insurance will only cover care from a provider in your network. And PPO allows more flexibility to visit providers outside of your network.
Alrighty.
Next question. What is the DRI for fiber for men and women through to the age of 50? Is it 38 grams and 25 grams, 28 and 18, 30 and 21, or 42 and 29?
Let's go with D.
That is incorrect. It's actually A, 38 and 25. But the average person only gets 15 grams per day. So diets rich in fiber can help reduce risk for heart disease and type 2 diabetes, improve cholesterol, and regulate digestion.
All right.
Last questions, I guess. What does BSE stand for?
I have no idea.
Oh, this is important for you.
Oh.
It's a breast self-exam.
Okay.
Women can choose to conduct regular BSEs, but this should not replace regular screening mammograms or clinical breast exams. And at what age should women get annual mammograms? Is it 30 to 39, 40 to 44, 45 to 54, or 55 and older?
I think it's B, but I thought they may have changed that. B.
They did change it.
Okay.
It's 45 to 54. So women 40 to 44 have the choice to start annual breast cancer screenings, but it's recommended that women ages 45 to 54 should get mammograms every year. 55 and older should switch to mammograms every 2 years.
Okay. Good to know.
The more you know. Thank you for participating.
You're welcome.
I hope you learned something today.
I did.
Your name.
Joanna West, fitness studio owner and instructor.
Great. All right, let's get started. According to the CDC, how many minutes of moderate intensity aerobic activity do adults need weekly?
D.
Yeah, you are correct. Yes. Next. All right. Which term is utilized in eye and vision care?
B.
Yes. Do you know what the other ones have to do with?
Orthopedics, bone, orthodontist, teeth, structure, maybe podiatry is feet.
Yeah. Ooh, you're good. Okay, what is normal blood pressure for adults 20 years or older?
120/80.
Yes, correct. Not so bad.
bad.
All right, which type of disease is high blood pressure or hypertension a main risk factor for?
Heart disease.
Yes. See, and you were nervous for nothing.
It's just the care.
What is the leading cause of preventable death in the United States?
Heart disease.
That is incorrect. It's actually tobacco use. Okay, what does HMO stand for? Is it Health Managed Organization, Hospital Maintenance Organization, Health Maintenance Organization, or Health Management Options?
C.
Correct. Did you look it up?
Maybe.
Okay, what does PPO stand for?
I think it's D.
Yes. And what's the difference between HMO and PPO?
PPO is more expensive and there's a deductible and you can go outside of your network if you want.
Yes. What about HMO?
You need to go through your primary care,
Yeah.
right?
Yeah,
For
exactly. Okay. What's the DRI for fiber for men and women through to the age of 50?
I don't know. A?
Yes, this is very impressive. C is actually for people over the age of 50.
Oh, so you need less as you
Yeah.
get older?
Yes.
Is it slower? Oh, that sucks.
Second to last. What does BSE stand for?
What does BSC stand for? Blood? Something? No, I don't know.
Well, they're on the same page, so they're related.
Oh, breast self-examination?
Yes. And at what age should women get annual mammograms?
I think it's B.
It's C, 45 to 54. So you can start at 40 to 44, and then 45 to 54 is annually, and 55 and older is every 2 years. Thank you for participating. Health literacy is an important determinant of health. Even where a person has advanced literacy skills, their ability to obtain, understand, and apply information about health may still be poor. Improving people's access to health information and their capacity to use it effectively is critical to enabling people to make informed choices about their health and enabling them to take an active role in bringing about changes in the environments that shape their health. Thank you for watching, and I hope you learned something new as well.